is the fourth most common cancer in the UK, after breast, prostate and lung cancer, with over 40,000 new diagnoses in the UK every year. It will affect 1 in 14 men and 1 in 19 women during their lifetime, with the vast majority being over the age of 50. Cancer of the colon and rectum is a process where the natural control mechanisms of cell proliferation are lost through a series of genetic mutations, leading to uncontrolled cell division. The majority of cancers within the large bowel start their lives as small polyps, measuring only 1 millimeter in diameter, and then gradually enlarge in size over the next 5 to 10 years, ultimately turning into cancer through genetic mutation. Benign polyps can easily be diagnosed during routine diagnostic colonoscopy, which is the fibre optic examination of the large bowel, when they can be removed and at the same time removing the risk of bowel cancer. The symptoms of colorectal cancer tend not to arise until the tumour has reached a significant critical size, and small cancers and pre-malignant polyps are completely symptom-free. So the key thing here is acting quickly when symptoms arise and early investigation, because the earlier a tumour is identified, the earlier the stage of the cancer, the more likely it is that the cancer will be curable. So, like all tumour types, prevention is better than cure. The common symptoms of bowel cancer include bleeding from the bottom, either fresh blood on the toilet paper or in the toilet, any change in bowel habit from the norm, including looser stool or an increased frequency of stool, or a deterioration in constipation would be of concern. Abdominal pain out of the ordinary, or weight loss are also worrying features. And finally, if the general practitioner has done some blood tests, any iron deficiency anemia suggests chronic blood loss from the gut. The latest surgical techniques are minimally invasive surgical techniques. For example, during a colonoscopy, which is the fibre optic examination of the bowel, polyps are routinely removed, and some of these larger polyps may contain a very early cancer. And in these patients, that polyp removal may be the only treatment the patient needs, with no requirement of surgery. Also, in a small percentage of patients, perhaps less than 5% of patients with rectal cancer, if the tumour is very early, it can be removed transanally, in other words, through the bottom, without the need for removal of a large segment of colon. So that again is considered to be minimally invasive. But for the vast majority of patients, the affected segment of bowel will need to be removed surgically. And the big advance in the last 15 years has been with the advent of keyhole surgery or laparoscopic surgery, where the bowel is removed with tiny cuts, much less post-operative pain, and therefore quicker return to normal activities and back to work quicker. And there's obviously a cosmetic component to that as well, as opposed to traditional open surgery where there would have been a large midline scar with a more painful recovery. As we've touched on earlier, prevention is better than cure for any cancer type, including colorectal cancer. And the NHS screening programme has been very comprehensive in its screening for colon cancer, and it is twofold. The first method of screening in the UK is with fecal occult blood testing kits, and these kits are sent out to the patient's home address between the age of 60 and 74 every 2 years. And the kit comes with instructions as to how to apply a small stool sample onto the kit. The kit's then sent back to the central laboratories, and it analyses for small invisible amounts of blood within the stool, which is what colorectal cancer will produce. The second type of bowel screening in the UK is known as bowel scope, where patients aged 55 are invited to come along for a one-off fibre optic camera examination of the lowest part of the colon, It's a relatively easy procedure that takes about 5 or 10 minutes. And for every 300 people screened, it's thought that 2 will be prevented from developing bowel cancer and 1 life saved from bowel cancer.